The action of the drug is realized mainly in the form of combination of anxiolytic, anti-anxiety and mild-stimulating activating effects. Afobazole reduces or eliminates anxiety, concern, but burdens, fears, irritability, tension, shyness, stiffness, anxiety, inability to relax, insomnia, fear, depressive mood, somatic manifestations of anxiety, muscular, sensory, cardiovascular, respiratory, gastrointestinal symptoms, autonomic disorders, dry mouth, sweating, dizziness, cognitive disorders, difficulty concentrating, and bad memory, including arising from stress disorders, adaptation disorders. Especially indicated in the use of the drug in persons with predominantly asthenic personality traits, in the form of anxious suspiciousness, uncertainty, increased vulnerability and emotional lability, a tendency to emotional stress reactions. The effect of the drug develops on the 5th-7th day of treatment. The maximum effect is achieved by the end of 4 weeks of treatment and persists after the end of treatment for an average of 1 to 2 weeks. Indications: Afobazole is used in adults with anxiety conditions, generalized anxiety disorders, neurasthenia, adaptation disorders, in patients with various somatic diseases, bronchial asthma, irritable bowel syndrome, systemic lupus erythematosus, coronary heart disease, hypertension, arrhythmias, dermatological, oncological, and other diseases. In the treatment of sleep disorders associated with anxiety, neurocirculatory dystonia, premenstrual syndrome, alcohol withdrawal syndrome, to alleviate the withdrawal syndrome when quitting smoking. How to use? It is applied on site after eating. Optimal single doses 10 mg, daily 30 mg, divided into 3 doses during the day. The duration of the course of the drug is 2 to 4 weeks. If necessary, on the recommendation of a doctor, the daily dosage of the drug can be increased to 60 mg and the duration of treatment up to 3 months. Contraindications: individual intolerance to the drug Afobazole, galactose intolerance, lactase deficiency or glucose galactose malabsorption, pregnancy, lactation, children age up to 18 years. Precautions: the drug does not adversely affect driving and performing potentially hazardous activities. With a significant overdose and intoxication, a sedative effect and increased drowsiness may develop. The drug does not interact with ethanol, does not affect the hypnotic effect of thiopental, enhances the anticonvulsant effect of carbamazepine. It causes an increase in the anxiolytic action of diazepam. Side effects: allergic reactions are possible, rarely, headache, which usually resolves on its own and does not require discontinuation of the drug.